Sunday, May 17th, Congresswoman Ayanna Pressley joins us live this morning. Let's go on the record. She's the outspoken and groundbreaking representative from the state's 7th Congressional District. Now she's bringing her progressive politics to the battle against COVID-19, what she's fighting for as the nation seeks a new normal.
From WCVB Channel 5, the inside word from Washington to Beacon Hill. Today's newsmakers are going on the record.
Welcome to another edition of Live OTR this morning. I'm Ed Harding, along with News Center 5's political reporter Janet Wu. We are live from our studios here in Needham this morning, and we are respecting social distance as we have throughout this crisis. And joining us live via Skype, again under the umbrella of social distancing, is Massachusetts Congresswoman Ayanna Pressley. She's a Democrat. She represents the state's 7th District, which includes Chelsea, which is one of the communities hardest hit by the COVID-19 pandemic. Congresswoman, great to see you. Thank you for joining us this morning.
Good morning. Good to be with you.
Good morning, Congresswoman. Thank you again for being here with us. House Speaker Nancy Pelosi's $3 billion package, which was approved on Friday, again includes individual stimulus checks. But, a lot of economists agree that it has been less effective in keeping the economy going instead of sending money to small businesses directly, which promise no layoffs. Shouldn't this next bill, if there is, of course, a next bill, reflect what really works?
Well, first and foremost, this is a crisis that is unprecedented. And to meet the scale and scope of the hurt of this pandemic, both a crisis within a crisis, a public health crisis and an economic crisis, is going to require future relief. What I'm focused on right now is how we address the public health crisis, and that means more testing. And once again, Congress is standing in the gap of an administration who sees themselves as the backstop. They have never been leading from the front. That is the worst position you want to be in confronting a pandemic. And because of their criminal negligence, their sluggish response, and their press briefings, which function more like disinformation campaigns, we have them pushing to reopen. And to do that being driven by a market and not by science. And so what I'm focused on is the public health crisis, and the HEROES Act, the most recent relief bill reported out of the House, does make formidable investments so that we can do the massive testing and contact tracing that we need to do. And other things that I can enumerate as we go on. But I just want to lift up one example. You mentioned Chelsea, which has been hardest hit, and we've seen that trend throughout the country and the Commonwealth, that Black and Latinx communities have been disproportionately impacted. Neighborhoods in Boston like Roxbury, Mattapan, and Dorchester, and then in the Massachusetts 7th, Chelsea, and also Randolph is trending that way as well. Just this week, I worked with Randolph in partnership with Beth Israel to get field testing in Randolph because they don't have a community health center, and they are also a transportation desert, if you will. And so this is the sort of collaborations that need to happen, and these are the sorts of things that we need to be funding. And the most recent relief bill gets us closer to that, and also puts the people first. It's providing relief for renters, for homeowners. It's providing hazard pay, something that I fought for, along with relief for our renters and homeowners. I fought hard for paid family leave, paid sick leave to be included, more investment in our community health centers, and also in previous relief bills, our immigrant neighbors were left out of those stimulus checks. And now with an I-10 number, they will be eligible for that. But we know that that one-time check of $1,200 the first time was not sufficient. No family can survive off of $17 a day for 10 weeks. And so we've made another investment with one more cash rebate of $1,200, but we need to do more.
So I guess, Mike, we were going to talk about Chelsea and about some of these other communities that are hard hit in just a couple of seconds here, but I wanted to go back to the stimulus check. You talk about the need for more testing for cities and towns, obviously, to get more money to do that, as well as provide a lot of the rent relief that's necessary. How wedded are you specifically to the individual checks for individuals, as opposed to, having them maintain their jobs and being paid through their employers?
Sure. I actually don't think that it's, I don't see it as an or, it's an and. We need to do everything. Again, the scale of this crisis is unprecedented, and we need to be focused on mitigating the hurt and providing relief across the board. I've had to recalibrate what is a metric of success as a lawmaker in this moment. I won't think that we've been successful and we've done our job until we don't lose one more life until a family is not sleepless at night because they don't know how they'll pay their rent or how they'll put food on the table, and a business isn't shuttering their door. That's the metric of success for me. And so until we've done that, we are falling short.
So let me ask you about the House. The House approved the HEROES Act, but how do you move it past the political posturing and get the Senate and the president to approve it when they have already said it's dead on arrival?
Well, again, there were many markers that were laid down in this most recent relief bill that I fought hard for and that I've been fighting for since this pandemic began, including the collection of racial data, disaggregated, publicly reported, to ensure that our public health response is equitable when it comes to access to testing and treatment and marshaling of resources. And we were able to get that legislation included in the last relief bill. So I'm an eternal optimist. You know, I will concede that it's challenging because we're often negotiating with people who are not good faith partners in their negotiations, who I think are very removed and disconnected from the real hardship that people are experiencing every day, and just moving with urgency. You know, these are the things I'm focused on: is how do we move with urgency? How do we ensure that whatever we do is impactful? How do we address the scale? And then how do we make sure that the responses are equitable when it comes to the public health response and the economic recovery?
You've talked about urgency, and you've also talked about, Chelsea, one model, and it is only one model, predicts another 2,000 deaths in Massachusetts by next month. That's on top of the more than 5,000 now on the record. Chelsea, as you said, is in your district. It's at the very top of that list per capita in the state. How do you stop these additional deaths from disproportionately affecting the Chelseas, the Randolphs, and others that are seeing way too many for the number of people they have in their communities?
It's just devastating, the loss of life, period. And, you know, there are experts in recent days who offered that we might have been able to prevent 90% of these deaths if this administration had taken the science seriously and acted more thoughtfully and responsibly at the outset of this. And so it's tragic. I do have to say, though, it's not surprising. You know, when you look at the heat map in Chelsea and you overlay that with infection rate, they line up perfectly. And the reason why I'm lifting that up is because this is a community that has disproportionately bore environmental injustices, has very high asthma rates, and because of the impacts, the comorbidity of structural racism, when you're talking about unequal access to fresh and healthy food, unequal access to health care, Black and Latinx communities have more of those underlying conditions. And that has everything to do about the ecosystems with which we are disproportionately living in. I would also add that in Chelsea in particular, that many of the residents also dominate the essential workforces. So their exposure rate continues to be higher.
So can anything be done about this to stop this next, what specifically can be done to stop what's happening right now, considering the number of deaths predicted?
Sure, the resources need to be targeted. So the resources have to be targeted. That's exactly why I introduced the Equitable Data Collection Act bill and fought for resources to be directed according not to population size, but according to infection rate. That's why we need the funding. That's why we passed this bill. I've continued to fight for a targeting, marshaling of resources. The data allows us to have the resources to follow where there are the most vulnerable communities so that we can do field testing, mobile testing, contact tracing, which is so critical, antibody testing. And invest more in our community health centers. The reason why you even know how devastating these numbers are is because of legislation that I fought for. And that's now a federal mandate that we are learning in real time what those numbers are. Anecdotally, we knew that these communities would be hardest hit. But the data confirms our worst assumptions, but also makes sure the resources follow the data.
And Congresswoman, there's another ripple to this. Another ethnic group, Asian Americans, have faced a great deal of animosity during this pandemic. The numbers show a major leap in gun sales and the use of GoPro cameras by Asians facing threats and taunting from strangers. What can be done about this?
What can be done about racism? Well, I think it certainly doesn't help when you have I mean, first of all, racism, it's more than culture and human behavior. It's structural, it's systemic. Exactly why I was saying why we see playing out in communities like Roxbury and Dorchester and Mattapan and Chelsea and Randolph. What we see playing out, racism is structural. And it doesn't help when the president of the United States has his own prejudices and offers hate speech. If you saw the exchange that he had just recently during that press briefing with an AAPI journalist, that certainly does not help. He fans the flames with his xenophobic worldview and his bigotry. From the very beginning, he was contributing to that with how he characterized the coronavirus. He kept calling it the Chinese virus. So again, he's very consistent. It's reckless, it's dangerous, it's hurtful, but it is consistent, and that's exactly why he has to be defeated.
Congresswoman Ayanna
He is dangerous.